All right, we are live. I am enjoying this evening. The girls and Courtney have gone shopping. I assume since they told me not to come, that they went Christmas shopping for me, which is, it's all right. I can deal with that. And since no one is here, I did decide to not shut the door all the way behind me. Let's give it a shot, see how things go. Excuse me. I did have to make a brand new batch of the Kool-Aid today. Some sort of cherry blast, something. That's what I got today. So, I had to do that. One of Courtney's teacher friends brought us some. It's like homemade chocolate with like peanuts in it. That it's sort of like a no-bake almost. And I, like an idiot, decided to leave them on the stove while I cooked supper this evening. Not thinking about it. I just moved them, away from the burners that I was using. Not thinking at all. And melted those chocolates. So they're in the freezer right now. Refreezing, I guess. So that was terribleness. But anything going on exciting today? It is like super, super duper cold outside right now. There's like a crazy winter storm going on right now. It's mad out there. We aren't getting any snow, but we're getting like super duper cold temperatures and wind, and it is raining, but nothing too bad other than that. But in any case, let's see, is this going to load up? This is not going to load up for me, so I'm not going to worry about this. There is currently, and I was asked to mention it, a children's medicine shortage that is going on right now currently. And I was asked to talk about it. So we'll talk about a children's medicine shortage. Let me get all my screens up so I can find an article that I really like that we can talk about. But currently, I'll say currently, in my local area, we have like a mass amount of pharmacies per population. Like, we don't have a huge population, but we have like 19,000 Walgreens, or Walgreens or CVS or whatever it may be. So I know that there is a shortage. I've been told there's a shortage. I've not recognized the shortage in my local area. Maybe we're fortunate, maybe we're blessed. I've heard just a little bit down the road, 30, 45 minutes down the road, none of the pharmacies have medications for children's. But like I said, I have not noticed you could walk in one of the drugstores at my house or the pharmacies at my house, and you'd be like, wow, there's a children's medicine shortage. And I haven't noticed it, because we are just fortunate, which I say that now. If I was to go to the drugstore today, there would probably be a mass shortage in the drugstore. But let's see. This is NBC News. I think that's the ones that's through the Peacock, right? Yeah, the Peacock there. Children's medicine shortage strain parents and pharmacies. CVS and Walgreens are limiting quantities of children's pain relief medication customers can buy at pharmacies across the country. Reports bare shelves. Pharmacies and parents across the country are competing with empty shelves as they search for children's pain relief medication amid spread of RSV, flu, and COVID. Now, I'll say, side note right now, I have never seen, in my entirety, I have never seen as many adult cases of RSV as I've seen this year. This year we have a mass amount of adult cases of RSV. Of course, I deal in adult populations, and I'm seeing cases of it. And I'm like, wow. I have never seen. I'm not saying it's ever impossible, but I have never seen adult cases of RSV like I've seen today. What's up, Queen? Queen, you got baby children. Maybe you can answer this. Have you noticed the medication shortage for baby medicine, children's medications, in your local area? Because I haven't, but I know it is going on. But the adult RSV is massive right now. Yes, you have noticed it. I haven't. I have not. But I say that now, and then if I was to go to the drugstore, to the pharmacy right now, we wouldn't see it. The surge of respiratory viruses has overwhelmed hospitals and doctors' offices. 76% of pediatric beds are full nationally as of Monday. What day was this written? This was written. I know it had a date. There it is, December 21st. So just yesterday. 76% of hospital beds are full nationally as of Monday, according to the data from the Department of Health and Human Services. A number of pharmacies are reporting shortages of children's Tylenol, ibuprofen. CVS and Walgreens announced Monday that they are limiting the number of children's pain relief medications a customer can buy. That is ridiculous. That it's come to that. But hospitals are full in Texas. I can tell you, I checked the wait times. I don't go to the hospital. I'm not in the hospital setting anymore. But one thing, nursing homes dump patients on hospitals when it's this time of year, when it's Christmas time. So nursing homes, they just dump patients at the hospitals. And two, it's that time of year where there's a lot of travel, there's a lot of stressors, things like that. But I check the wait times, I don't know, daily, a couple times a day, because sometimes you have to tell people, hey, you need to go to this hospital, more like a triage. I don't necessarily do triage, but there are times where I'm like, you have to go to such and such hospital, you need to go to another hospital, you don't need to be here. And I can tell you the hospital that I recommend the most, that is a little bit further away, maybe 20 miles away from us. The hospital I recommend the most has had roughly the same wait time as our local hospital. And that's, the 30 to 90 minute sit wait time, which is crazy. Some folks have to be transported down to Houston, near areas. What's your distance from Houston? Because, like I said, the hospital that I recommend the most is probably 20 miles. Ooh, 4 hours. Ugh. Don't you know that's a long ride in an ambulance? Hospital I recommend the most about 20 miles from me. I think, maybe. Might be less. I might be exaggerating a little bit, but it's not close. Our local hospital is not the best. Ugh. getting one of them big intensive care ambulances, one of the big ones. That's crazy. Anyways, let's take a little bit more of a look here at what they plan on doing here. At CVS, on both online and in-store purchases have capped at 2 medications per customer, while Walgreens limits online orders to 6, but not have a cap in stores. Well, that's quite a gap there. Let's see. I'm not worried about her. Well, now, just the other day we went out to eat, and Gator, my oldest, she calls them dragon pills. We called them dragon pills back when she was younger. She was like, "Daddy, I need a dragon pill. My head's hurting." And this was last weekend or the weekend before, so maybe 10 days ago now. And she was like, "Daddy, my head's hurting." So I walked to we were at a restaurant, so I walked down the road to a pharmacy, and I had no trouble finding anything 10 days ago. So I don't know. Antibiotics are really low. That's concern when the antibiotics start getting low. Kind of wonder too. We got a delivery of medication this morning. Excuse me. And our medication, unless it's some sort of emergency, we're completely out of medication, whatever. Our medication, believe it or not, comes through FedEx. It takes, so many hours or whatever. I'm almost certain that it's a special FedEx van, but our medication comes through FedEx. I wonder if antibiotics in these hospitals or whatever are most times delivered through a FedEx or through a UPS or through something like that, and they're having such a hard time due to like staff shortages and Christmas and all the shipping that's going on right now. I kind of wonder if that's hindering medications, because like I said, ours comes FedEx. I don't go knocking over FedEx trucks to get medication, but because like I said, I think they're a special FedEx truck. They'd have to be. There's no way it's not a special FedEx truck. Or a, maybe not a special FedEx truck, but like a, not a hazmat, something like that. Keep your child from playing with other children that are sick. But the parents want them to throw them to others. Yeah. There was so I used to watch this show called Scrubs. The very first season was really good. Anyways, there was a doctor in the show, and him and his wife had a baby, and the mom was gonna let strangers hold the baby, and the doctor dad pitched a fit and was like hollering at the mom, like, don't let him go to strangers. And then at the same time, the doctor dad like had the baby on one hand, balancing him way over his head. And the mom's like, "Oh, well, this is safe. And he's like, "Yeah, because all he's gonna do is break his arm. He's gonna get a terrible virus if he hangs out with these stranger people." So I always think about that, because I think me and Courtney do the same thing with the girls. I don't like them to. Now it's not so bad, but when they were younger, I didn't really like a lot of people holding the babies, because I was always worried that they'd catch something. And Courtney's always got that aunt or grandma or whoever it is. It's like, "Oh, I don't have anything." "Oh, how do you know you don't have anything?" You don't know you ain't got it. I didn't know I had COVID when I had it. I mean, when I had COVID, my temperature was 97.6 or something like that. I didn't even have a temp. I still had COVID, but didn't have a temp. So you never know what you got. Whereas a trauma can be fixed fairly easily. not fairly easily, but can be repaired. We'll say it that way. So I always agreed with that doctor whenever me and Courtney had disagreements as to what our children need to be doing. But it is what it is. Let's see. Oh, wow. I didn't even read this. I need to. So far, 30 children have died from flu this season, according to data from the Center of Disease Control and Prevention. Among the overall U.S. population, the agency estimates there have already been more than 150,000 flu hospitalizations and 9,300 deaths since October 1st. This has been a bad flu year. It just has. It's been a bad flu year. It's like I said, I have never ever seen adult RSV cases, and I'm seeing adult RSV cases now. Never seen that. But it is what it is. When your child gets sick, you'll get sick too. Yes, you don't want that mess in your house. You want to prevent that mess at all costs. You don't want them bring that mess home to you. They bring that what was the one going around a few months ago? Hand, foot, and mouth. Woo! I don't like that hand, foot, and mouth. That one's no fun. That one's not even fun. Like whenever you're you're not sick as a parent and your child has hand, foot, and mouth. That's no fun. Now Courtney got the flu right at the end of November, I think, right before Thanksgiving. I believe she got flu A, and we had to end up going to the hospital because the doctor's office wasn't open, wouldn't see her. Well, like we could not get an appointment to take her to the doctor's office, and she needed a note, since she's now teaching. She needed a note to sort of get out of work, not get out of work, but be excused from work. And that dang bill, and I'm not even playing. That dang bill is like $1,200 or something like that. Not a cheap bill. And then I was like, dang, all we had to do, if the doctor would have had an opening, all we'd had to pay was the $50 copay or whatever it is. Now we're responsible for $1,200, and I don't even think they gave her any medication. I don't even think they gave her Tylenol in there. They might have gave her Tylenol, but I don't think they did. It's like, dang, can't win for losing. Just got hit with this $1,200 bill. Ugh, it's crazy. Yeah, crazy. So I got to reading more about this news article about this mom whose child has a rare kidney disease. And his body can handle Tylenol, but not ibuprofen. And it reminded me of back when I was in dialysis. When I was in dialysis, they, for some reason, had a bottle of ibuprofen in the Pyxis. It was like the go-to medication if a patient got a headache or whatever. And we're like, are you serious right now? Like, we need Tylenol because it's absorbed in the liver, not the kidneys. Ibuprofen's absorbed in the kidneys and not the liver. Like, you're gonna set these people up for failure. Give them ibuprofen. I was like, you can't do that. Although, I'm almost certain that somebody at central ordering, is the one that made that boo-boo, is the one that made that mistake. because you can't do that for a patient on dialysis. You can't give them ibuprofen. But I'm assuming that the doctor probably ordered pain reliever and did not specify, and then somebody down in Central Supply was like, "Oh well, we'll just send them ibuprofen. It'll be fine. You know, it'll be fine. Whatever." And I just remember my charge nurse was like, she was mad. She was like, "I cannot believe y'all sent us ibuprofen. My patients can't have it." And they ended up letting us keep it. And they said, "Well, just give it to your nursing staff for whenever they get a headache." It's little things like that you gotta, you should probably know whenever you're, working in specialized facilities. We also, when I was in dialysis, we had a saline shortage. And saline is, you went through like gallons upon gallons of saline on one patient. What would happen if you give a patient on dialysis ibuprofen? Is that what you're asking, Queen? I'll let you answer that. But we went through, one patient went through probably 4 liters of saline, which is a gallon, and that was on a good day. And we had a saline shortage, and that was no fun. So what happens is certain medications are absorbed in certain areas of the body, and so if you give a patient on dialysis with chronic kidney failure ibuprofen, it cannot be absorbed in the body. So, just imagine having something in your system that can't be processed. Think about the old adage, where they used to say if you swallowed gum, it would take like 10 years or whatever to get through your system. So, sort of think like that. And that's sort of what the ibuprofen does in the body of someone with chronic kidney failure, someone who's on dialysis. Let me Google it and see if ibuprofen, if they explain it better than I can, because I am definitely no professor of medication. But it is not good for a dialysis patient to get ibuprofen. Let's see. Can be taken for a limited time by dialysis patients. Should make it long term. What? No, I don't like that. Oh, kidney.org. Let's see here. Jewish Medical Center. I've always heard of a Jewish Medical Center, but never read anything. Let's see. Oh, well, that's a case study. I don't want to read a case study. Let's see. Here we go. This guy, National Health Service, James Tattershall, sounds like he understands what he's talking about. NSAIDs like ibuprofen are hardly ever used in patients with chronic kidney disease, including those on dialysis. This is because of the prostaglandin is required to dilate the arterioles in the blood inlet of the glomeruli to compensate for the reduced renal function. NSAIDs block the prostaglandins. Oof, I am the worst pronunciator. My vocabulary is terrible. And has effect on shutting off blood flow and failing in failing kidneys. NSAIDs occasionally have been used to perform medical nephrectomy to stop severe glomerular protein leaks, even at the cost of requiring dialysis. NSAIDs are also cause of internal nephritis, a cause of renal failure and allergic inflammation localized in the renal tubes where NSAIDs are concentrated. In dialysis patients with no renal function, NSAIDs are more likely to cause side effects as they accumulate, and their toxic effects enhanced by the uremic state. Intestinal bleeding, a likely side effect of the NSAIDs, is more likely in dialysis patients due to the urematic clotting defects. Ugh, he used too many big words. Entirely too many big words for me. Basically, it builds up and up and up and up and up, and your body can't process it, and it just stays there, and then it does terrible things to your body. I wish he would have used smaller words. We used to have, so my aunt who actually got me into nursing, she has unfortunately passed on, but she was a VA Duke or a Duke VA research nurse. In any case, she worked at Duke, but like through the VA. Anyways, she basically walked around with like the smartest of the smart doctors. You know, the guys that talk in those big words like that, and would translate for the patients to the doctors, because they could not get on, like the same page. Like she said, I remember the example that she gave me, that one of the patients said he's got the miseries. He said he's got the miseries, and the doctor's like, what is the miseries? Like, what are you talking about? And the doctor was like, is it due to your lack of flatulence? And he's like, no, I just got the miseries. I can't fart. I got the miseries. And my aunt was like, yes, you two are saying the exact same thing. He can't fart, and there's no flatulence. He's got gas, in him. And so my aunt was like that, like translator between the smartest of the smart doctors and regular people. That's what she did. Very, very smart woman. Unfortunately, cancer got her at 48 years old, and she passed on. But she did get me into nursing, before she passed on. Well, she gave me the idea to get into nursing. But they would always translate stuff back and forth. They could not figure out what they were talking about. So this doctor that just wrote this, she would have been the person that would tell the patient, hey, you take ibuprofen and it builds up in your system, and it'll eventually kill you. When I was back to dialysis stories, back when I was in dialysis, patients come in with end-stage kidney failure at all ages, and we had young people, 20 to 30, and they would go to like big parties and party hard on dialysis, and dialysis people don't pee. Basically when you do dialysis, it takes all the toxins out of them, and so they would be like hammered drunk and show up in dialysis, and you're pulling all the alcohol out of them, because they can't pee, can't get it out. They've probably been drunk 2-3 days, just not feeling good, but good times. Excuse me, my eyes is crusting. Now, where are we? Let's see if I got off on a tangent. What's going on with the children's medicine? Um, I think that's about the end of it because they're talking about people now. You know what? I tell you what, we've had a hard time getting. We cannot find here at the house is a thermometer. We cannot get a hold of a thermometer for the babies. There's like none nowhere. And I don't like the ones that you put under their tongue and take like a minute. Cause my kids ain't sitting for no minute. You know, you get that 8 to 10 second one or whatever, the Vicks, and like that's all the time you got. You got that 8 to 10 seconds. You might get that, but they're not doing a minute. It's that ain't happening. Order yours on Amazon. I may have to do that. I like some things I like on Amazon. A lot of things I do like on Amazon. But some things I like to hold in my hand. But even the last time I bought a thermometer at Walmart, I didn't like it. And when I got it home, it wanted me to set up an app and make a profile. No, I don't want an app or a profile for my thermometer. All I want to do is, point it at my child's head or put it under their tongue or whatever it may be. I don't need to track temperatures every day. I don't need that. That would be good for those expected mothers that are, the trying to keep up with their ovulation cycle or whatever. Because what is it? At the most fertile point, your temperature is higher or something like that, or lower. I can't remember. Something happens at your most fertile point. Your temperature goes up or down. I can't remember. But that would really only be beneficial to those expecting moms. But anybody else, like regular people, I don't need to know my temperature, 10 days ago. I was sick then or I wasn't sick then. Let me be. I don't want to, I don't need to know it no more. It's just not something I need. Let's see. Oh, I just had a clock come up on my screen to tell me that there is 17 minutes until Thursday night football. I have not seen a single professional play football in years upon years. Not even the Super Bowl. I haven't even seen that in forever. I watched the Panthers in 04, I believe. That's the last one I really remember. 04? I think I was a senior, yeah. That was my senior year. Junior year, senior year. Somewhere around there. 03 or 04. Whenever the Panthers went. That was like the last time I saw anything from them. In any case, Cowboys making you so mad. Watch sometimes. I've never had a team. It's never been a sport that I've ever cared for. I've never watched it. I didn't grow up with my dad, so I had my mom. She really didn't care for football. That was, so it wasn't on at the house. I think that probably plays a big role in it too. I didn't, wasn't on. I didn't have it. I think maybe if I'd have grown up with a dad, maybe he would have watched it and I'd have seen it then. I don't know. I don't know. In any case, was it the Jets and the Jaguars? It's gonna be a team with a J that wins tonight. Oh, big yawn, excuse me. Big yawn. I need to, and I want to, do a vlog style video of getting up and then, basic getting dressed. I'm not going to show everything getting dressed. But do a day in the life of LPN. I keep meaning to do it, and the only reason that I haven't done it, the only reason, and this is my laziness, because I don't, maybe procrastinate's the best word for it. I get up at the very, very, very last second. Like the absolute last second I can get up and get out the door is when I get up. I need to do better, and I need to do that myself. And that is the only reason I have not done a full-fledged get up day in the life of LPN. And I would like to do one. Today would not have been a good day to do one, and I'll tell you why. Because I was able to refill my coffee cup at 2 hours past when I filled it up the first time. A good day would be like, I fill it up at 5 a.m. and then I fill it up again at like 9 a.m. But today I filled it up at 5 and 7 or something like that. Like I think it would be a better day if there's a longer gap between hands. That way it would be, a more realistic day. Because today doesn't happen very often. But, it's not sure if it was because of Christmas or what. The holiday coming up. But I am planning on doing one. I hope to do one. I hope to do one soon. I just got to get my lazy tail in gear and do it and wake up. So that I can get myself up in gear. I just got a text from Courtney that they are leaving now, and I told her that I would not be live streaming, because I told her I was going to live stream. I told her I would not be live streaming when she got back. They're about 20 minutes away, so I'm going to give it about another 10 minutes. So we're at 38 minutes right now. I'm going to shut it down at 48 minutes. Just FYI. Because when she gets home, I'm going to have to help with baths and things like that. So I was fortunate enough tonight to get the ability to live stream now. And I would like to try to live stream later in the evening like this. I think it would be better because people are out of work and stuff like that, but I would like to do it better. But let me ask you this, Queen. Without violating HIPAA, and of course, I don't want y'all to see me get dressed. What is something you would like to see in a day in the life of an LPN video? Like, you want to see, the charting? I could probably do a quick couple clips of me typing real hard, and say charting number 1, charting number 2, charting number 3, something like that. I could probably do that. Of course, I cannot show patients. I cannot show any information. I can't show anything like that. I might be able to. I could probably show a count. Um, but don't have to be at work talking about it. Okay, all right. Sorry, just texting Courtney back. All right, I'll do that. I'll figure something out. And if I get it wrong on my first attempt, I just I just retry it. Retry to do another day in the life. Without showing my badge. I wear my badge upside down every day, and everybody always asks me about it because they told me I had to wear one, so I wear it upside down. But I could easily just take it off, put it in my pocket real quick. Yeah, I could definitely do that. That would be no problem. I think my boss would be okay with it too, because my boss she's not the one that wanted me to do the video about work, but she had been asked for me to do one. So I think she would be okay with me doing one at work as long as I'm not, violating any HIPAA. What I really want to show, and I got a really good stick this morning, but I know I can't do that. I know I can't. There's a channel called RN Scrub, and they have the ability to do stuff like this. I really want to show a good stick, like a good one. To me, I don't know, something about just a good solid stick is just, that's one of them skills you have to get. I don't, the Foleys and the catheters and things like that, those are cool, but I don't like them as much. But I would love to show, an arm that doesn't have, you can't see anything, and then somebody just get a good solid stick on that arm, or one with a lot of juicy veins or whatever, and you still get a good solid stick. I would love to do one of those, but I am fully aware I can't, without violating somebody's HIPAA rights. I'm not exactly sure how Dr. Pimple Popper, she doesn't do sticks, but she does dermatology. I'm not exactly sure how she gets away with it. She's got to sign some sort of waiver. I know she doesn't show anybody's face, but you still hear voices and stuff, the patient's voice and whatnot. I'm not exactly sure how she gets away with it, with doing the procedures on camera, because I would like to do that. I would love to do a video where somebody's like, "Hey Chris, can you get this for me? I can't, I missed twice," or whatever it is. And then I would love to do that. That's my dream video. I don't want to stick one of my kids though. If we ever have to do employee stuff, I don't think that'll ever happen though. At first, I don't know. I keep getting my microphone standing in the way. Let me read this again. First, it was okay until the 5 nurses did the X on TikTok. What is the X? Sticks. I bet that's sticks. Yeah. The nurses on TikTok, maybe YouTube too, but I'm not seeing it on YouTube. I'm seeing more content like this. Of course, channels come up that are like-minded, I guess is what you want to call it. But it seems like the nurse on TikTok, they get brazen. I don't. Maybe it's an age thing. Maybe YouTube nurses are older. I don't know. But like that one TikTok nurse, like posted a video like right after one of her patients died. She like crying in the hallway. I was like, bro, I understand that you're upset. We all get upset. We all grieve different ways, but not the time, man. Not the time. Like it was that was too much. I don't want to say it was too much. If she would have done that shift like showed her leaving the hospital that day, I think it would have been better. But like if I have a patient death, that hits me hard, I'm not gonna do anything at work. There's too much to do. As bad as that sounds, it's not easy. There's too much to do that you're worried about, that rather than doing a TikTok about it. And one nurse that was local, she was 20 minutes away from me, was like doing TikToks and stuff, and she was like on the code court, and she had the AED. I think I had an AED or a Zoll. It was either AED or Zoll. Anyways, she was like, got these chest pads. Hope I don't need them tonight, and like slammed it down and stuff like that. It was like no, that was a bit much. Like you can't be doing that stuff. Let me see if she still comes up. So she was suspended over TikTok videos. Let's see. Some of her jokes were out of line. Yeah. Let's see if she has any. No, they don't have any like examples and stuff. But she was like, yeah, unprofessional using the social media platform. She was on TikTok and like on the code card. Ha 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 ha. Hope I don't gotta do this tonight. Like bro, you never want to get the code card out. Like nobody wants to get the code card out. It's no fun to get that code card out. Now sometimes I will say this. Sometimes as a community, your team of nurses will sort of get together and maybe tell jokes or console each other or whatever it may be after a code. But we don't like do jokes like that or nothing. I remember one time, and this got talked about for a long time. It was back when I was on diabetic unit. We were in a code, and patient, we had just switched compressions, and I was the second nurse to go into the compressions. And so the first nurse did her set, and it was my turn. And so I'm wearing it out. I'm doing my compressions, and I'm about 5 or 6 in. I'm not very far into it. No one was coming to help us. We'd been ringing the code button for a good maybe minute, and no one was there. 3 nurses in that room. Excuse me. And so I'm doing my compressions. I'm about 5 or 6 in, and the patient looks at me and goes like that, and I was like, yes, I was just so excited, and then they take it and then go right back out. And I was like, yeah, and then I was just full of emotion. And I was like, no, and I slapped him right in the face. I was just so angry. It was just so much emotion that had just happened in that moment in time. I slapped him in the face. All right. And then the patient goes, like big, loud, snory sort of breathing. And so at this moment in time, respiratory done showed up, doctors had done showed up, and plenty of people had just saw me slap this patient in the face because I'm just so full of emotion. And then the patient ended up living. So for a long time after that, the team that happened to be in there and see that was like, oh, what point in time in a code do we slap the patient like in the face? So I was known for that for a little while. there was another nurse that was doing her not BLS training, ACLS training, advanced life saving care training, and they were like, what do you do if compressions don't work? And she raised her hand, and they were like, yes, Cheryl. She's like, well, if you do like Chris, you slap them in the face and they live. I was like, oh, they should have been there. Yes, should have been there. And the worst part of the whole situation, the absolute worst part of the whole situation, the patient was there because their grandbaby had just been born. And for whatever reason, grandbaby being born maybe threw them in some sort of crazy emotion, and they happen to be diabetics. They come to a diabetic unit, put them in some sort of weird arrhythmia, with their heart, AFib or something like that, and showed up to the hospital for grandchild to be born, and then has to stay in the hospital because they go into AFib or whatever, and then end up coding on the dang unit. And so everybody, the whole family was there. Literally, the code happened. I slapped them. They came back to life. And then when we walked out of the room, because you have to do paperwork and stuff like that. When we walked out of the room, all the people that were there for the baby to be born are now outside the room where this code just happened. And they're full of emotion now too. They just welcomed a new baby into the world. Did this person just leave the world? They don't know what's going on. And so it was crazy. The hallway was just packed full of people. I was like, dang, this is ridiculous. I am so glad that this had a good turnout. And I ended up talking to the patient a little bit later, and they were like, I am so glad to be seeing you. And I said, I am so glad that you are looking at me right now. So I saw you a little bit ago, but I am so glad you are looking at me right now. And they were talking and everything like that. One of the very few cases where I've actually seen a code go well was that one, when I slapped the patient. But just full of emotion. It was just wide open, just ready to go. But in any case, I've already gone 4 minutes over when I said I was going to be done, because I got Courtney coming home from Christmas shopping. I'm sure she's going to be on edge when she gets here, so I'm going to have to take the girls over as soon as she gets here, because I imagine that was probably pretty stressful, with how full the stores are, and she had to keep an eye on 3 girls all by herself. She's got her grandmother with her, but she still probably did all of it by herself. So I'm going to go ahead and head on off of here so I can help with the baby children when they get back. Thank you guys for joining me today, and I hope to see everybody sometime soon. Maybe a Christmas live stream. I don't know. Christmas is on a Sunday. I typically don't like to do Sunday stuff, but it's a little bit different because it's Christmas. Maybe do a live stream on Christmas Day to wish everybody a Merry Christmas, but we might be full of family stuff too, so no promises. But see everybody sometime soon. I will see y'all later. Thank you guys so much for joining me. Good night.